This book has a strange history. In 1979, why we held at Tougaloo and at Millsaps College really the first Freedom Summer reunion. That time in 1964, when 1,000 volunteers came down to the state. And we had planned the event, and at the first meeting in Woodworth-Chapel, our historic building, all King and all the speakers presented their ideas. We were walking up the steps, and my doctor, Bob Smith, he's the blues brother right there in the middle of the book, was out on the steps of the chapel handing out leaflets, picketing. And I said, Bob, what is wrong? I mean, we got this program together, and here you're out. He says, you have not included a program on the Medical Committee for Human Rights, organization I have found, which played a very important role in Freedom Summer. And I said, okay. It was an organization I had vaguely heard of. I had come to Tougaloo in 1967. By that time, MCHR had moved out of the South. Well, flash forward to 15 years later, I had written this book on the movement, and I had devoted a full paragraph to the medical committee, which contained 2 errors of fact. I was on my way to a 30th anniversary reunion was held. I was on my way to a session that everybody was heading toward, because Bob Moses and Bernice Regan were going to talk about teaching the movement to children. So I was in that crowd, and all of a sudden this arm comes out and grabs me. It's Bob Smith. You're coming downstairs. He had gotten a session on the medical committee and insisting that I go there. Well, I went down and met terribly interesting people such as Tom Levin, Alvin Poussant, and others who were medical committee stalwarts. And I realized that I had missed something, that this was a group whose story needed to be told. And one thing led to another, and I decided that I would do a book. The problem was sources. And another problem, in writing local people, of course, there was a ton of secondary information on the civil rights movement in Mississippi. Not too many historical monographs. The journalists had covered it well. The first-person accounts, I could find some new things, but I basically knew the narrative. You know, starting with, well, I moved back to World War II, but starting with the Brown decision, moving up through 64 and 65, and culminating for me in 1968 at the convention where the Loyalist Democrats were seated. With the medical committee, it was very different. There was nothing out there on the medical committee. I could not find not only one monograph, but one article that took the organization from the beginning to the end. So I did not know how I was going to do this book. I knew that oral history would play a big part in the, if I were going to put it together, but I was going to need some documents. So I kept asking around and had developed a correspondence with Jack Geiger, who is one of the most prominent members of the committee and, of course, the father of the comprehensive community health center movement. In fact, your School of Public Health is going to give Jack an honorary degree at commencement this spring. And Jack said that there was this fellow in Philadelphia named Walter Lear, and Walter is the man in the glasses in the back. I was able to give a cover with 2 of the most important people in my story. The third, Mike Holloman, was a very distinguished black physician and activist from New York, who was once president of the organization. And he said that Walter had been collecting this information for years, and that he felt that I should pay him a visit. So I went to Walter's home just off the campus at Penn, and he took me up to his 3rd floor And all of us historians sort of dream about going into somebody's attic and finding everything we need. Well, this wasn't Walter's attic, but he had all these boxes, and not only that, he had them arranged by year, which was a real advantage. And so I decided to do it, but I decided not to have an interview with him or anybody else right away to see how that organization had developed. So unlike my other books where I knew basically what happened and was trying to add some depth and analysis to it, here I didn't know. Each day I went in fresh, and for about a year, not every day, but going back and forth to Philadelphia, going through box after box, learning about the medical committee on the fly, so to speak, being very discouraged sometimes, knowing that in 1966 it almost came apart. I couldn't wait to see what happened next, but refusing to ask the questions that you would ordinarily ask. So it was a mystery to me, and very much worthwhile as a result. What I found, of course, was that this was an organization that was, as Jacqueline has said, begun during Freedom Summer. As a result of the decision to bring down all these volunteers, why Bob Smith was then a physician, a young physician in Mississippi. He was a Tougaloo College physician. He was our family doctor. But in '64, he was one of the few doctors who would not only treat civil rights workers for their various ailments, but do so for free. I talked some about the history of the impact of Jim Crow on black physicians and their patients. For example, and here's another lucky thing that I found. I found the starting point of my book. You know, that's always where you're going to start. And I not only found the starting point of my book, but a great cover shot from the New York Times of June 21st, 1963. This was a demonstration in Atlantic City against the American Medical Association, staged by a handful of activists who would later become the Medical Committee for Human Rights, against the AMA's policy. It was not the AMA policy so much as that of their local medical societies in the South. And that is, they refused to admit black doctors in many areas, many states. And this was more than a social slight. It meant more than you couldn't go to the dance and the dinner of the organization. It meant that you didn't have hospital privileges. Because this was a classic example of catch-22. You had to belong to the local medical society in order to get hospital privileges. You couldn't belong to the medical society because you were black. The parent organization, the AMA, had always taken the position that, no, we are against discrimination, but the local membership the local societies have the right to determine their own membership, and we're not going to intervene. Much like the AFL in its early days. We are against segregation, but we are not going to prohibit our locals from excluding blacks. So this was a demonstration then to bring this to the attention of the public. And as a result, 2 years ago, the AMA officially apologized to blacks for excluding them for all of these years, which is a certain amount of progress, I think.